Welcome to Tapping Wisdom. I'm Sue Paternack, and I'm delighted to welcome Dr. Dung Trinh, who I met a couple of years ago when I was conducting an offsite with RID Medical in Irvine, California. So, Dr. Trinh, would you please introduce yourself to our audience and tell us about all the variety of things that you're involved with?
Sure. Thanks for inviting me, Sue. Excited to be on your show here, your podcast. And I wear a whole bunch of hats, and I'm the chief medical officer of a number of organizations in the health space. The first one is Estiva Health, which is a Medicare Advantage health plan that I'm their chief medical officer. We, of course, take care of our members, our seniors, very similar to like Scan Health or any of those senior health plans. And we're in Orange County and in San Diego with plans to grow outside of these counties. I'm also the chief medical officer of Irvine Clinical Research. We are located inside of the Alzheimer's Orange County building. And we're really the largest independent private research organization dedicated to Alzheimer's on the West Coast, with a staff of close to 40, and dedicated to bringing better treatment, better meds to those suffering from memory loss and Alzheimer's. So it's a clinical trials organization. And I'm also chief medical officer of a national organization in the biotech world, Cognivue. Cognivue is the first FDA-cleared device that is a computerized memory test that will evaluate your memory and your cognition within 5 to 10 minutes and spit out some results that are FDA cleared. So those are some of the hats I wear outside of public speaking, health education, and a lot of other things that I do on top of that. So basically, it's just untreated ADD. So I'm good with that.
So why don't we start with your leadership roles in your Alzheimer's research, because you seem to have a lot of passion around that. Can you tell us a bit about what that is, where that comes from, and what your hopes and dreams are and aspirations for the work in Alzheimer's?
Absolutely. Have been a primary care physician for close to 20 years with initially Bristol Park Medical Group. Then we morphed into MemorialCare Medical Group, and I had been with MemorialCare even up to now, actually, as one of the hospital docs. But for close to 20 years, I was taking care of many patients. And because of where our office is located, close by the Laguna Woods, the majority of my patients were older patients, and
that's a senior community in South
community,
Orange County. Yeah,
close to 20,000 retirees, and I saw the entire spectrum of memory loss. Patients who were initially completely independent, they would drive in, we would have great chats and things of that sort. And slowly over time, I noticed the slow changes in their memory to a point where they couldn't take care of themselves anymore. And now a caregiver, a family member would take them in. And I saw the decline of memory. We gave the diagnosis of Alzheimer's, and it was a huge impact on me personally, because it was the one diagnosis outside of many diagnoses that I didn't feel there was a lot of treatment options or hope. We, over the last 10 to 20 years, we have improved on our care for diabetes, for hypertension, for heart disease, for cancer. We've created new medications. We've lowered the death rates of heart attacks and strokes and things of that sort. We have survivors of heart disease, survivors of strokes, survivors of cancer. We have no survivors of Alzheimer's.
oh,
And it made a big impact on me. And I was writing death certificates and signing them, and these were my patients. And I felt that I need to do more. And in 2017, I stepped down from a busy primary care medical practice, and as one of the medical directors for a MemorialCare facility at the time, to dedicate my time to Alzheimer's care, and took on the leadership hat of clinical trials for Alzheimer's, and also to bring the message out to the community that there is a lot more that can be done for your memory with lifestyle changes and nutrition and diet and things of that sort. As a health educator in the community, it's been a passion of mine that I never had a chance to do as a primary care physician, seeing a patient every 10 to 15 minutes, right? We never had the chance to discuss prevention. And so yeah, it's kind of what I'm doing now.
And so can you tell us a bit about what you're sharing with people about how they can either mitigate the onset of Alzheimer's, or they can minimize or slow down the symptoms of it, and how and through the lens of like, how can you influence people to either make changes or to start things that they haven't done before?
Absolutely. In Orange County, Alzheimer's is the #3 cause of death.
Wow.
Yeah, right behind heart
Wow.
attacks, which is number one.
Wow.
Cancer is #2. Alzheimer's is #3. And so you ask yourself, why is Alzheimer's the #3 cause of death? In Orange County, one, it goes undetected. Two, everyone thinks that memory loss is part of normal aging.
Mm.
Patients, when they're in their 60s, 70s, and 80s, when we start losing, the ability to recall words and names and places and things, the first thing we think of is, hey, I'm getting older, right? Of course I'm forgetful, I'm getting older. And so as we do that, this condition called Alzheimer's and the plaque that builds up in the brain of Alzheimer's patients continue to progress. So we end up missing this diagnosis to a point where by the time most patients are diagnosed with Alzheimer's, they're already in the moderate stage of this disease. We miss entirely the mild stages of Alzheimer's, which
So
can go on for years.
Yeah.
And that's on the patient side. On the physician side, we don't even look for Alzheimer's until a patient comes up and say, doctor, I have memory loss. Then it pops up in our radar. Part of the reason we don't screen well for this condition is, first, in the 10 to 15 minutes you have with your doctor, you're talking about your chief complaint. You're reviewing your medications, you're getting referrals, you're reviewing lab results, you're talking about consultants, you're addressing hypertension, diabetes. Where does memory loss even come into play in the 10 to 15 minutes you have with your doctor? So there's a time constraint with discussing Alzheimer's or bringing it up. The second issue is most doctors also feel that, hey, you're forgetful. Okay, let's move on. You're forgetful. You're 80 years old. What am I going to do for you? Right. And so there's this perception that there isn't anything that can be done. And that perception is completely wrong. In 2020, during the pandemic, in the journal called Lancet, right, a major medical journal called the Lancet, a large study was published identifying 12 modifiable risk factors for Alzheimer's.
12.
That is modifiable. Yeah, modifiable through lifestyle, through nutrition, activities, things of that sort, that contribute to up to 40% of Alzheimer's. 12 modifiable risk factors. And so this is just lifestyle stuff that people can do. The problem is doctors don't have time to talk about this. Plus, they're not aware themselves, and nobody's out there educating patients in the community. So I took that on as a role and a task and a mission to go out there and let folks know that, that there is something you can do. I lecture about 100 times a year this year. Pre-pandemic, about 200 times a year. I'm in the community doing that.
Wow. Yeah. So you talked about those numbers for Orange County. Do we know what those numbers are, either statewide or nationally in general? Is it pretty much a match, you know?
Yeah,
Yeah.
so nationally, Alzheimer's is number 5 or number 6. It's higher in Orange County simply because we live longer, actually, than the rest of the country here in
Oh,
Orange County.
okay. I thought you were going to say we have
Oh
more
yeah,
older people here, but no, it's that we live longer here. That's
yeah,
interesting.
there is. Yeah, we
Wow.
live longer, so there is more older people here.
Okay. Oh,
Absolutely, there's more
okay.
older people here,
I
and
gotcha. Gotcha.
so these, so the key thing is that, of the top 10 conditions that kill Americans, from heart disease to cancer to strokes to whatever these conditions are, we are making scientific advancements in all these conditions. We're driving down the death rates of heart attacks and cancers. The one condition we don't have a handle on now is Alzheimer's, where the
Why is
death
that,
rate
do you think?
continue to improve. Well, two things. We don't have a medication that has been successful
Mm.
in the stopping Alzheimer's. So we don't have a medication that is FDA approved to prevent Alzheimer's, to reverse Alzheimer's, to stop Alzheimer's. So that's number one. We don't have successful treatment. Partially because, quite frankly, you can't treat Alzheimer's with a pill.
Mm.
Right? You can't treat Alzheimer's with one medication. This is a multi-factorial problem. And really it starts with lifestyle and prevention. And it starts with what we do, with what we eat, with how much sleep we get, how much exercise we get, and all that. So you can't treat a problem that's multifactorial with a single pill. Having said that, in our clinical trials, we are looking forward actually to 2023, where some of the medications we are evaluating at my office, in our office, Irvine Clinical Research, is coming to the FDA for an approval decision, which is very exciting.
Congratulations. Yeah.
Yeah, medications that can clear the plaque in your brain. First time ever, that with clinically statistical positive results in memory, in affecting memory.
That's
So
huge. So can I ask you to just walk back a little bit for people who are not in the medical world? Tell us about,
yeah,
about what you mean by the plaque in the brain and how that's related.
absolutely, absolutely. If I were to do an autopsy on the brain of an Alzheimer's patient, there are 3 things I will find in that brain, in every brain with Alzheimer's. And those 3 things are this. There is a plaque that builds up in the brain of an Alzheimer's patient. We gave that plaque a name, so it's an Alzheimer's plaque, but the official name is beta amyloid. It is
Beta
a plaque
amyloid.
that just
Okay.
builds up. Beta amyloid detected in every brain with Alzheimer's. So that's number one. The second thing that we will detect is another protein called tau, T-A-U, tau neural fibrillary tangles protein. And these are proteins that are seen in every brain with Alzheimer's. The amyloid plaque and the tau protein, the tau tangles. So we have this term called plaques and tangles when we talk about Alzheimer's, and that's what it is. It's amyloid plaque and tau tangles. The third thing we will find in the brain of every Alzheimer's patient is a lot of inflammation. Inflammation that builds up. And so around the plaques and tangles is inflammatory cells, like kind of like debris, right? The consequences of damage that occurs. And so we believe that that the inflammation is a driver of plaques and tangles. The tangles is the tau tangles is located inside the brain cells, whereas the amyloid plaque is located outside of the brain cells.
Okay,
And that's
got it.
how
Yeah.
geographically they're located in the brain of an Alzheimer's patient. And so in the last, I don't know, 20, 30 years, there have been hundreds and hundreds of clinical trials with testing lots of medications to tackle this pandemic, really, called Alzheimer's disease. The success rate of a clinical trial in getting to the FDA with a successful Alzheimer's medication is under 1%.
Oh my goodness. Wow.
99% of clinical trials in Alzheimer's end up at failures. And this is this is for another 1-hour discussion sometime.
Yeah, sure.
But partially because there are over 30 different factors that lead to plaque production. And when you have over 30 different factors, including genetics, that lead to plaque production, it's hard to try to design one pill to address all this. And therefore, 99% failure in Alzheimer's clinical trials. Now, having said that, one of the medications at our office, lecanemab is the name of this medication. It's the pharma that has this medication is a partnership between Eisai and Biogen. And so this is the first medication going to the FDA this coming year, 2023, for accelerated approval decision. This is the first medication that has been shown to clear up the plaque in the brain.
Okay.
And in removing plaque in the brain, it also clears up the tau protein, which is very interesting. And at the same time, it has shown a mild to modest positive benefit with the trajectory of memory loss. What we have seen is that compared to the placebo group, right, the group that was taking the placebo, the treatment group taking lecanemab over a period of 18 months, we were able to slow down the rate of memory decline by 27%.
Wow.
Compared to the placebo group. And that was really neat.
That's
it
really
was statistically
significant.
significant. Very significant. It's not a home run. It's not a slam dunk. It has not cured Alzheimer's. What it did do was buy us some time in our family, our friends, our neighbors who have been given this diagnosis of Alzheimer's. And this is the study was done in patients with mild dementia, mild Alzheimer's, or pre-Alzheimer's, which we call MCI, mild cognitive impairment. That's the study group. So we'll know January 6th, whether you're listening to before January 6th or after January 6th, we're going to find out. We're going to find out what happened to this.
That's right. So considering your point earlier about how little time and emphasis physicians have when primary care physicians have when they're meeting with their patients,
Right.
how do you identify people who are pre-Alzheimer's and what are those symptoms?
So I'll tell you what I'm doing with my CMO hat for CogniView. Right, CogniView is this little laptop FDA cleared device that is portable because it's like a laptop. You bring it around, you can open it up, and it doesn't require a trained psychologist, psychiatrist, or an MD to administer this test.
So it's one of those, what's today's date, who is the president, those kinds of questions.
So not those kinds of questions. You're kind of playing a little video game on this little device, and as you're doing that, it's assessing your cognition and your memory.
I see.
And
So it's actually
as you're doing that,
Yeah.
Yeah. So you feel like you're playing a little game, but it's actually collecting data on how this is doing. And within 5 to 10 minutes, it spits out results. I'm taking this device to the community itself.
I see.
I'm not bringing it because doctors don't have time. I'm taking it to the community and having it done. So it is done at, for example, Florence Sylvester Senior Center in Laguna Woods. It is done at RID Medical Group. It is done at Irvine Clinical Research. This device is also available at the Mount of Olives Adult Day Center, which is a brain health center that we have designated. 24/7 Care at Home is a home health organization that offers this. I'm taking this to the community. We're going to do testing in the community. Results can be sent to their primary care physician, or we can offer recommendations, with our nurse practitioners and others. This test is we're offering at no cost to the community. It's also done now. We've just opened up and have launched this testing at 2 pharmacies that are local, ABC pharmacies. So this is what I'm doing. If the medical infrastructure do not have time to evaluate and test for brain health, let's take it to where the patients are, outside of the medical office. Adult day centers, senior centers, pharmacies. That's what I'm doing. And this is how we're going to get the message out on the need to evaluate and test so that we can give you health education on the 12 modifiable risk factors that you can do with your lifestyle to lower your risk for Alzheimer's. We're going to take this out and branch it. We also launched in Long Beach as well. It's a new office I'm launching. The
Okay.
Healthy Brain Clinic.
Healthy
Yeah,
Brain Clinic and launching into LA County.
that's
So
right.
it sounds like, yeah. So if I was looking at this from a leadership lens, you have not only, joined groups who are doing this group and helped propel them to another level, but you've also taken the initiative to create new opportunities as well as to advance the research yourself, right? As a practitioner, boots on the ground, actually collecting the data and trying to identify prospects for research and treatment.
Absolutely. Research and treatment. I believe the ultimate treatment for Alzheimer's would be some type of combination therapy. There isn't a single magic pill. You have to include lifestyle. You have to include nutrition, exercise, and things of that sort to minimize the risk of collecting more plaque while you remove plaque with existing medications. It's got to be combined, and that's the path we are paving.
Yeah, that makes complete sense. I would be remiss if I didn't ask if you could talk about the 12 factors. I'm assuming nutrition, sleep, and exercise is part of that, but I know I'm curious. I'm sure people listening would be curious to hear that as well.
Absolutely. That's if I can remember all 12. My memory's not that great.
Yeah.
But yeah, so here you go. I'll tell you what I do remember. Nutrition, obviously, very important. There is a diet that is called the MIND diet, published in several journals, in several studies. In one study, this diet had lowered the risk of Alzheimer's by 54%
Oh
through
my.
nutrition alone. Oh
Wow.
yeah, in one study, right? So super important. Second thing, we know there is an association between high blood pressure, uncontrolled high blood pressure, and Alzheimer's. So modifiable risk factor, lower your blood pressure, keep it under control. Third thing, sugar. There is an association with diabetes and Alzheimer's. We know that those who have diabetes have at least double the risk of Alzheimer's as those who don't have diabetes.
Oh my. And is that both type 1 and type
Why
2?
is that an issue? Why?
Yeah. Okay.
Yeah,
Yeah.
Alzheimer's is often called diabetes type 3
Oh my.
because of that close association between Alzheimer's and poor blood sugar. Okay, so that's significant. That's a modifiable risk factor. right? With lifestyle, with meds to control your blood sugar. Next one, being overweight is a risk factor for Alzheimer's. We know that those who are overweight not only are at risk for Alzheimer's, but are obviously at risk for other health conditions as well, right? At risk for diabetes, hypertension. There are 13 cancers that are linked to being overweight.
Oh, wow.
And it's, yeah, and it's not because you're simply, overweight. It's probably the lifestyle that leads to the weight gain, right? It also leads to other health conditions. I think being overweight is an inflammatory condition, actually. And inflammation obviously is connected to everything else. So that's a modifiable risk factor. Another modifiable risk factor, hearing loss.
Oh, interesting. Can you tell us a little bit about
Yeah,
that?
hearing
Yeah.
loss. Yeah, the brain is like a muscle. It needs to be used on a regular basis, like a muscle. And when we talk about muscles, it's either use it or lose it, right? You're either
Yeah.
using your muscle or it atrophies and it gets smaller. So how do you use the brain as a muscle? You have to stimulate it. You have to stimulate it. So anytime you're stimulating your brain, you're using the muscle, right? The brain muscle. When you have hearing loss, you are losing an entire portal of brain stimulation when you can't hear.
Oh my, wow.
Yeah. So
Huh.
so that's modifiable risk factor. It's very modifiable because it's treated with a hearing aid.
Yeah.
Right? A
Yeah.
hearing aid fixes that.
Yeah.
Most people don't even realize that. And it's very important. We got to get that message out, right?
So
Get your hearing
interesting.
checked on a regular basis and address it, right? Don't ignore hearing loss because it's a risk factor for Alzheimer's. Another modifiable risk factor is socialization. We know that those who socialize on a regular basis have a lower risk of Alzheimer's than those who are home alone all day not socializing. Huge, right?
Wow. Yeah.
Another modifiable risk factor is insomnia or getting adequate sleep. When we sleep, the brain is recharging and brain is restoring itself. When we sleep, the process of plaque removal is occurring as part of the brain kind of cleaning out itself. When we are not sleeping well, we get into trouble because plaques not getting cleared. So this Alzheimer plaques accumulate. So we got to make sure we're getting adequate sleep. And it's a chronic problem in America. Nobody gets enough sleep. Right?
And can I ask you a follow-up question about that?
Yeah.
I have heard that it's normal as people get older for them to require less sleep over and they do sleep less. And as opposed to say teenagers who require more sleep. So does sleep requirement change over time?
It is true that as we get older, we don't need as much sleep, but there's still a minimum threshold. And we recommend at least at a minimum, 6 or 7 hours of sleep. So super important. So modifiable risk factor. Next modifiable risk factor is exercise. Regular aerobic type exercise, super important, and it's very consistent. Every study looking at exercise and Alzheimer's have shown that exercise lowers the risk of Alzheimer's. Every study.
And you were
It's very
specific about
consistent,
aerobic, right?
and it's the one thing we
Necessarily
can all do.
bodybuilding, right?
Walking, right? Walking. It's really about getting your heart rate up, right?
Okay.
Getting your heart rate up. So even walking, something to get your heart rate up would be super good. We recommend at least half an hour, 4 days a week if possible or more with that. So that's a modifiable risk factor. Next modifiable risk factor is smoking.
Yeah.
Smoking, right? Yeah. Smokers basically have a higher risk because it's toxins that you're adding to your body. These toxins increase inflammation in your body, and that increases the risk of Alzheimer's. When we talk about toxins, the next modifiable risk factor is excessive alcohol use.
Mm.
Right? Excessive alcohol. I'm not talking about a glass a day of red wine, right, which is part of the Mediterranean diet, which is fine. I'm
Okay,
talking about excessive alcohol use.
sure.
We know that that destroys the brain. That's a modifiable risk factor.
Mm.
Another modifiable risk factor is air pollution.
Mm.
Those who live in areas of high pollution have a higher risk of Alzheimer's than those who live in areas of low pollution. So there you go, right? Everything I've mentioned so far does not require a pill to lower your risk for Alzheimer's. Maybe it requires some, a health coach to help you along. Maybe it requires a support group of folks doing the same thing to help you along. But yeah, none of it's a pill, and these are all modifiable risk factors that we have control of to lower our risk for
Sure.
Alzheimer's.
What occurs to me as I was listening to you, especially when you mentioned the one on air pollution, is health inequities, right?
Absolutely.
Right, because there are people who live in communities where there's high air pollution, and they don't have the means to get out, and they live in food deserts where there
Yes,
aren't healthy food choices, right?
100%.
Yeah, can you comment on that and
Yeah,
what can be done to
those
help those communities?
Yeah, well, those who live and these are areas of socially economic, minority areas. We know that Blacks have a higher risk of Alzheimer's
Mm,
than Caucasians, right?
mm,
So we know that the Hispanic community have a higher risk, and they fall in these health equity areas
mm,
that and the data is showing that the health risk is higher for Alzheimer's. How can we solve this?
mm,
That is a huge issue to address. The first thing we should do is when we do clinical trials and research, we need to involve more of the community that that are underserved. Most of the studies being done now are enrolled by 90%, Caucasians, and
mm,
it doesn't reflect the actual community that we need to treat.
mm.
And that's a problem in research. So that's the first thing we ought to address, is to push for research involving more of these communities to reflect the true community that we treat. Um, the health education I do, there's no cost. There's not a financial barrier. So we would go out and we would partner with organizations that are minority organizations. And it's one of the reasons we have actually expanded from our Irvine clinical research to Long Beach.
Oh,
Long
good.
Beach is an area that reflects more of the community that needs help. And so it's a reason we have an office there now, is to try to reach that community. We have to embed ourselves in these communities and engage partners who are part of the community, and speak that language and build trust. And
Uh,
yeah, that's kind of my focus on that.
yeah, and so that sounds like it has been going on, and there's more of an effort to move in that direction, for even more inclusivity. Orange County having become much more diverse over the
Yeah.
last generation, still may, not have equal representation from a research standpoint.
Right.
So expanding to Long Beach, for those who are listening who don't live in Southern California, is just north of Orange County and is part of Los Angeles County.
Yes.
It's a
Yes.
city within Los Angeles County, just from a
Right.
geography lesson. So I thank you so much for sharing, Young, your leadership and your vision, and and your healing heart, to the rest of humanity. I mean, any of us and all of us are at risk for something that really has not been as understood and has not been as prioritized, and yet it's incredibly devastating, a way for people to pass. And I love the proactivity and in preventative factors as well as some of the research that you're doing. So I'm wondering if you could, if you were speaking to people who say, wow, I'm looking to do something in an area, whether it's medical or not, that hasn't gotten a lot of attention that I think is really important, to make the world a better place. What are some of the takeaways that you would advise them to do? Like, what worked for you?
Yeah, to be, I think one of the takeaways is the value of building trust
Mm.
with your target audience. The value of building trust. A lot of folks in the business world approach me thinking of, we have this business for your brain, we have this product for your brain, and this new thing for Alzheimer's, and my usual answer is, before you want to build from a business perspective your business bank account, you need first to build trust account with your community. And that's an entire process of going out there and giving value to what your community needs. Always build trust. Trust comes first, and everything else comes after. And that's kind of what I believe is serve. If you want to be a leader, be a servant leader. If you want to lead by serving, and serve those who you want to reach, is what I would suggest. and
That's
and
really great. That's very
and I
consistent
would
with
also,
my research that found that there's with all the disinformation and misinformation about COVID, the distrust of patients of their physicians when physicians were giving advice was a source of burnout for them.
absolutely.
So your approach of, it's almost like retail politics. It's like retail education, retail health
Mhm.
education,
Yeah,
getting out small groups, making a difference,
right.
making an impact, which then of course, spreads almost virally in the community.
Absolutely.
Mhm.
Yeah. So that's my thought on that. Build trust, and then go chat with Sue, who's got organizational leadership skills.
That's funny. So is there anything that I haven't asked that would be helpful to know or that you'd like to share?
Well, yeah, if anyone wants to learn more about what I'm doing, they can just simply go to a website that I have. It's healthtalksoc.com. Obviously, we're expanding beyond OC now, so we may have to change that somehow. But healthtalksoc.com, they can find our educational materials and content on Alzheimer's and on longevity and anti-aging and all the other stuff we do. And of course, this podcast here will be on there as well. So yeah,
And
thanks so
we will have that website posted as well.
awesome.
Uh, Thank you very much, for Dr. Dung Trinh, for your leadership, your love of community, and your incredible talents. You're incredibly multi-talented. So I hope that you have found this inspiring and informative. Please feel free to reach out to Dr. Trinh. In the meantime, I'm Sue Paternack, and this has been Tapping Wisdom. See you next time.